right, we're back for another FitDoc Recovery Series, and I'm excited to be here. We're at Illuminate Sweat. Thank you for hosting us, and we're gonna have a great time. This is like a group fitness, high intensity kind of facility. They have a little bit of everything. Group fitness, they have a sauna, and they have cold plunge. They have pretty much have it all. And I have a very special person with me today, and this is Miss Anastasia. And she was one of my patients almost like a year ago. It's been a while, huh?
Yeah, October of 2023.
2023, a little over almost like a year and a half. Mm-hmm. And so we're going to go through some different styles of exercising. And so one of the points of this is really just to find something you enjoy, to get back into health and fitness. And Anastasia is really, really hardcore into this, and I really enjoy her passion and enthusiasm for this style of exercising. So it's not going to just be weight training today. We're going to do something fun. We're going to do some group fitness style workouts. So let's get started. And so the classes that you're doing, tell me about this group fitness style. It's, are you doing this like a couple times a week? Is it like 2 or 3 times a week?
I try to go Monday, Tuesday, Thursday, Friday.
Okay.
So 4 days a week.
Nice.
And sometimes if I can come, I'll try to come on Saturdays.
Okay. And the classes are about, I'm assuming, like 45 minutes to an hour?
During the week, they're an hour. And on Saturday, they are 45 minutes.
Oh, nice.
Yeah.
Nice. Well, first of all, my comment is I like that it's indoors. It's not outdoors.
Yes.
I'm not a big fan of CrossFit. People who watch me probably know that. But CrossFit boxes are typically more in an outdoor setting, in the garage setting, and so I don't like the sweat. No, that's a personal secret.
Yes, it's called Illuminate Sweat, but you're not sweating. It's not a hot room.
Yeah, I like it.
Yeah.
Cool. So you've had we kind of talk about the recovery series of this and kind of chit chat while you're stretching out. But you've had some procedures before. You had some before I got to you.
Yes.
And then I got involved and just I felt like I was just doing a little bit of touch-up stuff.
Yes.
What you think?
Yes. So I had a tummy tuck and breast lift with some lipo before COVID, and I gained some weight, wasn't happy with my hips, and then I heard you talking about the Renuvion and the Vaser and the results you were getting.
Yeah.
And I was like, okay, I have to do it. So yeah, you touched up my hips and did some lipo and tightening. Yeah,
I had just gotten that the new Vaser system and the Renuvion system. I was so excited. I was getting some great results, and so Anastasia works with us. She's one of our nurses in our facility, and so she was kind of seeing it and hearing me talk about it a lot. And we were able to kind of do those things for you. So it was kind of neat to see, kind of go through that transformation of that procedure. So good. And then you really got into more like the fitness stuff, don't you think? Afterwards?
Yeah, I was actually kind of doing other things before I found this gym.
Yeah.
But it ended up being way too hard on my joints and stuff. So when I found this, it was just perfect for me. It was a lot of strength training with a little bit of cardio mixed in there.
Yeah.
And so.
But what were you doing before you got to here? Were you doing any like yoga or Pilates?
I was doing functional HIIT workouts.
Okay.
So, but they were pretty much working all the muscle groups every workout. So I like this because one day it's upper body, one day it's lower body, so you know what you're working on. So you're not doing your whole body every single workout. So your muscles are getting the rest it needs, right?
Yeah,
so,
that makes sense. Yeah. That's a good way to do this. That's kind of an aspect of weight training that you really want to I don't like the whole body workouts. I like splitting things up. So every week I hit something like once a week for the most part. Yeah. I let the muscles recover, and then you go back at it the next week. So good.
Okay, so
what do you do next? You do something. You start with the upper body. Do you lower body first?
So like normally it would be to where we just do like on Mondays we would do upper body, then it's lower body on Tuesdays. Wednesday's a total body class, which is kind of why I skip it because I like to do my individual body parts, and then it goes back again. Thursday's upper, Friday is lower. So cool. So but sometimes it's just lifting classes where it's just lifting, or they have what they call just sweat classes, so it's a combination strength training with lifting.
And a little bit of everything.
A little bit of everything.
Good style.
Yeah. So have you run on one of these before?
No.
I know you don't like to run.
I don't run.
But these are good. So a lot of times we'll do, it's self-propelled. And I like it because it's easier on my joints than a regular treadmill or running outdoors. So.
Does it have you don't turn it on?
No, it turns. And I would start more towards the back of it. If you want to go slower, the more up to the front you go, the faster you're going to go.
Oh, that's interesting.
Yeah. But I like it a lot better than a regular treadmill.
It's like curved or something,
Yeah.
huh? Mm-hmm. Look, Chase, I'm running.
I know, we got it on film, yes. But yeah.
What do you think, Chase? I run like a gazelle, don't I?
But you did it. But I like it because it's easier on my joints.
So it's all self-propelled. That's cool.
Yeah.
I've seen these in gyms. I've just never tried one before.
Yeah. So yeah, it's
pretty cool.
Because with a standard treadmill, you put the speed and you're kind of stuck going that speed. But if you're running on your own, you're not going to constantly be running,
Yeah.
5-6 miles an hour. So.
What do you do next?
Okay. So we can go over here. And these are the benches we use. So it's not a super fancy bench or anything. So we can either, set it up to do like incline bench presses and stuff, or just using it as a step. So, sorry, I'm a little winded just after doing that little bit. But a lot of times we'll have our stations are up on the TV, but and we kind of have it's 10 to 12 minute long at each station.
Sure.
So a lot of times we'll just, and you're going at your own pace. They'll tell you how many to do. So like this month, they do a lot of progressive overloading here. So like in the rack, like every Monday, it'll be the same exercise that you're doing. And you'll start off with doing more in the set, right? And each week you're going down, so they want you to go up in weight, right? So the progressive overloading.
I see.
So, and we keep track of all of that. So, sorry, I'm a little winded just from that little bit on the treadmill. But
well, I like that you're doing weights, because we were talking about this earlier. Remember, I think one of the longevity hacks, now that we know more and more about the human body, and we understand more about the metabolism and the aging process. Never in the history of mankind did we know so much about the physiology.
Yeah.
And so I think, you look at the generations before us, they didn't really focus a lot on exercising and maintaining muscle mass. And so, one of the aspects of longevity is that if you can maintain muscle mass, your bones will stay stronger longer, and your muscles will stay stronger, and your metabolism stays more kind of on par of health. And so
definitely, I believe that too.
It's so important to have resistance training incorporated into whatever form of exercise you like. So I tell people all the time, I'm not asking you to be a bodybuilder. What I'm asking you to do is just do something with resistance. And obviously weights are probably the best thing for resistance, right?
Yeah.
So, did you do a lot of weight training before until now, or?
I was kind of, I messed with it, but I was never really that much into it. I grew up in that generation where it was like Jane Fonda style aerobic workouts,
So true, yeah.
And that's what I grew up with.
Yeah.
And so I told them one of my goals when I joined this gym is I wanted to be more comfortable in the rack, like doing the free weights and stuff like that, because I'm just not comfortable doing that. So, and I've gotten better. I still have a lot of room to.
This is a great exercise for stability of the leg and the knee.
Yeah.
So
Yeah.
it is definitely more of an advanced movement. Definitely want to be a little careful with this one.
Yep.
But it will definitely help with your core and your knee strength and your joint strength. So
yeah, these were not the shoes to wear to do that. But yeah, and so one of the other ones we have the assault bike, which you've seen that at the gym that Corey was looking at.
It's a little bit of weight training, and you incorporate some of these more high intensity kind of things. Yeah.
Yep.
I was thinking about getting one of these for Corey. She would love this thing, I think.
Yeah.
This is a big CrossFit thing, right?
CrossFit? Yes, and I would never do CrossFit.
Yeah, me neither.
That's just too much for me.
Yeah.
But I think the key is just finding a gym and a form of exercise that you like you said, that incorporates strength training, because I told you, I have lots of older women in my family that I see they can't even get out of a chair by themselves.
Yeah.
You know, and I'm like, that's not going to be me.
Yeah.
It's not going to be me. Okay, I'm not doing that anymore. But
I think you told me that, like you knew someone that couldn't get out of a chair.
Yeah.
How old were they?
Mid to late 70s.
Man.
So not that old.
That's not that old. It really isn't. Now, especially now when how people are living so much longer.
Yeah.
Yeah.
So definitely not that old. And I was like, I just, that is not going to be me.
Yeah.
But,
going for the big weight. I like it.
But yeah, so I'm like, that is not going to be me. Old lady knees popping, sorry.
Yeah, I heard them. That's a great exercise. It's really kind of helping when you with the glutes and the hamstrings there. When you put your heels up like that, it can really help with the joint strength, and she's getting a little more quad activation there, especially with her depth. You're moving like a 20-year-old, Anastasia.
Hey, someone told me I was aging in reverse. I will take it.
I like it.
But yeah, and then like, this is one of the exercises I struggle with. But
What's that?
This right here.
Oh, the kind of the row thing, yeah.
Yes. But so like this is like I was saying, like we've been doing these every Monday.
Yeah.
And you know, the first Monday of the month, we'll start off with 12 reps in the set, and then it goes down each week. Mm-hmm. And then like this coming Monday would be our heavy set, where we're only doing 6.
Yeah. I would say my key points of this is just making sure you keep your back nice and straight and strong, and not arch your back. When you start arching your back, you're going to definitely cause some increased risk of injury. So one of the fundamental back exercises of any kind of row movements, not necessarily pull-ups, but a row. So I like that you have multiple hand positions because it changes the angle and the tension on your back.
Yeah.
So I'm sure they're kind of rotating into different grips, right?
Yeah.
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 Cool.
What's comfortable for you. But then, they don't have it set up right now, but we'll do like back squats or we'll do box squats.
Yeah.
And it just kind of changes throughout the month, and we'll focus on one thing.
Good stuff.
Yeah.
Do y'all do like free squats?
Do we do what?
Free squats?
Free squats?
Yeah. Yeah, like putting a bar in
Oh,
here.
yes, we do.
Yeah.
We do. I could probably take one of these off and I could probably take one of these off and
Yeah, we can do that. No problem. Is that something y'all do often?
Huh?
Do y'all do it often?
Yeah.
Okay.
So one of the things I think is important is post-operatively is to take care of yourself. And for me, that was working out and eating better. I had to see a nutritionist. I had to find a gym with a type of workout that I liked so I could stick to it. But it's given me confidence to get back into the gym and just to maintain the results that Dr. Morales gave me. But I feel better in my clothes. Like I normally wouldn't wear, a little crop top showing my belly and stuff like that. But now I'm like, okay, I'm comfortable doing that. So I think it's very important to just work out, eat right, to maintain those results and to enhance the results that you got with surgery.
What would be your number one tip to help someone get started adding fitness into their lifestyle?
So my number one tip to add a workout consistently into your life would be to try multiple different things. Like, take me for example. I used to work out by myself, like at Planet Fitness or Crunch, and I never stuck to it. But I started trying different group-based workouts, and I found that I enjoyed that more because they hold me accountable, like the friends you make in class, your coaches. So I enjoy it. So try a bunch of different things, whether it's Pilates, yoga, something like Illuminate. Just find something that has a little bit of strength training too, but just keep trying things until you find something you like, because if you like it, you're going to stick to it.
You like doing squats?
Yeah, but I need to work on my mobility because it's terrible. I'm going to take my shoes off.
Like, what do you mean? Like your
my depth is not that great,
Well, I wouldn't focus on depth. It's more about just keeping your posture correct.
Okay.
You know what I'm saying?
Yeah.
be some of your key points to think about when doing squats, Dr. Ross?
Well, she did something that I would say, more bodybuilders are doing and weightlifters, is she took her shoes off. And so you see all these, these social media superstar bodybuilders, these influencers, and they're training within socks. And so, if you're doing anything heavy that's kind of load bearing on your spine, squats, deadlifts, those kind of things, having more of a stable surface when you're pushing your pressure through your feet onto a hard surface is much better than being on a squishy shoe. So running shoes for weight training, specifically like squats, that's like one of the worst things you can do. So that's why they have, like in powerlifting, we have the platform shoes, are basically a hard sole, right? And that's why they do that. It transmits the force a little bit easier for you. But you had great form on that. Good job.
Thank you.
Good. Squats are, I would say, if you could pick like the top 3 exercises you could do for longevity, this is one of them. Not necessarily you have to do it on your back. I mean, you could do it with like dumbbells to your side. You can do squats at home. Just grab, I don't know, you had nothing, just grab some milk jugs or something like that and kind of hold it like this and you can do squats.
Yeah.
But it really helps your posture and your core, it helps with your back, it helps with your shoulders, obviously full leg, development. And for muscle mass, I think it's important to do compound movements, and this is called a compound movement because it's using multiple muscle groups at one time. So if you can do anything for longevity, like you got to keep up the squats. So you have good form. Good job.
Thank you.
It's hard for people that are taller.
Yes.
People have long femurs. It's harder for them.
Yes,
So,
and that's why I used the wedge when I was doing the goblet squat.
Yeah.
Because I can't get that depth on my own, so I need to have my heels elevated.
Yeah.
And it helps.
Yeah, I think so too. There's different, variations of squats, and it can focus different tension on different parts of your legs. So if you turn your feet out just a little bit more, you'll get a little more over your hamstrings, a little more your glutes. But always protect your knees. So always make sure your knees are stable. And we start doing like heavier stuff. I would strongly advise you wear like some kind of abdominal support, like a belt or like a waist trainer or something like that.
Is that just so I know I'm engaging my core? Or why would you recommend that?
You want to make sure your core is nice and tight and stable. So more of a back support than anything.
Okay.
So I don't think it's really beneficial for longevity to lift like a ton of weight for like squats. Like you really don't need to do that because the more load bearing you have on your spine, the more compression your disc of your spine, which is little cushions of our spine. And then as we age, they become more brittle, actually.
Yeah.
And so, I had one of my best friends, he's like almost 50 now, and he was just doing something just normal he's always done, and he just felt like a pop, and he got a herniated disc, and those suck.
Yeah.
Those suck. So you don't need to do like heavy squats anymore. So if you're over 40 and you don't have back pain yet, consider yourself super blessed. Like, having back pain is awful.
Oh, it is, because I have a little mild herniation in my back, so I don't go super heavy because I don't want to.
So don't stress it, right? Because it's a compression cushion, those little discs. So the more you squish it, the more of a chance you're gonna have a herniation. But it's really about just maintaining good form, good abdominal support, which translates to good core support, and then the movement is very, very important. Again, load bearing your spine, just don't need to do it. Like let the kids do it when they're young. I was very thankful I was in powerlifting, I never hurt my back. And I have friends that I powerlifted with, and they all have, some of them had back problems when they injured themselves young, and that's really, really catching up to them now.
Yeah. Well, I'm glad you told me that, because it's a wide age range that takes this class, and sometimes I'll see these younger people doing like all this weight, and I'm like, oh, that should be me. But I know I can't go that heavy because it's going to end up hurting myself.
For longevity, the days of ego lifting are over. Please don't do that. Don't try to compete with anybody. For me, like in my observation of CrossFit, don't get mad CrossFitters, is that there's a lot of ego into that, and they're like, oh, I want to do that, and you start trying to do these things, you don't really have the experience doing it, and you end up hurting yourself.
Well,
it seems like I've seen so many people, so many CrossFitters that I know that all hurt themselves. And it has a lot to do with just you're in a group setting, you want to kind of not show off, with a little bit of ego, and I want to do that, and then they end up hurting because they're really just inexperienced in some of these things.
No, that's when I worked in a neuro-elective spine unit. I would have to say probably half of our patients were CrossFitters. Oops. Yeah, so that's why I was like, yeah, CrossFitters.
Did you hear that,
not for me.
CrossFitters? Did you hear that? Yeah.
Sorry, my CrossFit friends.
I have some of my best friends are CrossFitters. They hate me, but anyway, I think for longevity, CrossFit is not a good, just a good modality because just explosive movements, and it's really the inexperienced ones that tend to get hurt, and that's the problem. I just don't.
Yeah.
You know, it's bad getting hurt. You know, for longevity. So.
Yeah.
Yeah, I'm glad you're doing squats. That's fantastic. Yeah. Do you ever do the TRX thing?
What's the TRX
This thing here?
You know, those, I did those when I was at a different gym, but I haven't really done them here.
Do you know what these do?
It's like where you're pulling your body weight,
So these are kind of cool because they're, you know, it's just using body weight to kind of do like a lot of like lap, like this. Like this is a great movement.
Yeah.
And you can kind of change your angles of how you're putting your elbows into your body. You can do wide, right? You can do low. I mean, there's really whole classes of TRX.
Yeah.
I mean, there's gyms that all they do is TRX for like an hour. And it's pretty cool because it's you basically use the leveraging in your weight basically.
Yeah.
And you kind of control the resistance to some extent. So
Yeah.
these are cool things. It's just a strap. It's super simple. I mean, you could do this at your home.
Yeah.
Yeah, and there's whole like books on TRX. So it's whoever designed that's pretty smart. But and then bands. You ever use bands?
Yes, we do.
Cool.
We'll do the bands. Just kind of, we just wrap them around. So a lot of times we'll just do things like to where we're just going across our body. Oh, that's not right.
Yeah.
And these are, like you said, things we could do at home. It's like I bought a bunch of these during COVID, so I could try to do some stuff at home, but I still gained weight because I ate so much.
Yeah.
It was there was nothing to do.
Yeah.
So I gained a lot of weight, and then I was just getting older.
I think, and we talked about this before, Anastasia. We talked about, you remember, going through like the menopause stuff, having symptoms and stuff like that. And the changes in a female's body going through menopause, it just becomes harder to lose weight, and it's harder to do it. It seems like everything. I mean, it seems like your body just kind of self-destructs in a sense.
Yes.
And I've talked about this in other podcasts about, going through menopause, stuff like that, and staying fit during menopause, and how important it is for to get through menopause a little bit easier with fitness and eating better.
Yes.
But there's a lot of things, the hormones are changing your body that you just have a little bit more struggle with. So I think we had talked about hormone therapy before, right?
Yes.
And I think you're on it now, right?
Yes, I am. I tried the gels, the creams, and the patches, and I can't do the patches because I have a sensitivity to the adhesive. But I ended up doing the pellets because it was just more convenient for me. But I have, my sleep is better.
Yeah.
It might be TMI, but I could have cared less if my husband touched me. Like my libido was non-existent.
Yeah.
But it's improving that. So I'm definitely a firm believer.
It's a life changer, right?
Yes, it is.
Seriously, yeah.
So I know, like, because my mom never talked about it. It's just something that was taboo. You don't talk about it. And now I think more women are like, okay, it's important because it's important for our cardiovascular health and our bone health and all of that. So, and I noticed I actually am putting on muscle, whereas before I was losing muscle no matter what I was doing.
Yeah.
I was just losing it, so it helped with that.
So important for women to really pay attention to their bodies as they get through that transition of their lives.
Yeah.
And the importance of fitness and diet is critically important.
Yeah.
And then seeing someone who understands the hormone therapy is also very helpful. See if it's something that can be introduced to help with the health. But I know a lot of people, including my wife, who's going through some of the changes, and I think the replacement therapy has been a game changer.
Oh yeah, it is, and sometimes it kind of sucks being a woman because sometimes it's hard to find a doctor that's going to want to prescribe it for you, especially if you're perimenopausal, right?
Right.
And luckily, I found a doctor that she's doing it herself, so she gets it. So it's like you said, it was just a life changer for me. I have more energy.
Yeah,
it's
sleep better.
Improved a lot of things in my life.
Yeah, skin's better, right?
Yes.
Big time.
Yes.
I'm glad you're on it.
Me too.
Makes me happy.
Me too.
And just seeing you exercising and enjoying it has been really cool to see.
Yeah. It's what I tell people. It's my therapy.
Yeah.
It's my therapy because we all have things going on in our life, and self-care is so important. And this is, when I'm here, I don't think about anything else, and it's just taking care of me.
Yeah.
You know, so
Good.
that's good.
Good point.
Good.
All right. What else? What else?
What else? Well, we can go back over here. Like, you don't need a big old fancy bench or anything, you know, we'll just do like chest press here, you know.
I've done this on a FitDoc Recovery Series before, but I'm anti-training chest with women who have implants on the muscle. And if you guys have watched my FitDoc Recovery Series, we had talked about that. And so there's 3 exercises I do not recommend women who have breast implants under the muscle. And this is one of them. And it's called the chest press with weights for the purpose of trying to get stronger. So it's going to be chest press, chest flies, and dips. So those 3 exercises, those three exercises alone, I do not recommend that you do, ladies. Everything else, please go ahead and do it. Don't message me, don't comment below. Well, what about this? I'm telling you, there's only 3. Do everything else. But if you don't,
but I don't have implants, so I'm good.
and you don't, go ahead, feel free. But yes, you can do, and if you have implants, you can do like push-ups with body weight. And that's really not a whole lot of weight. We're talking about training for the purpose of getting stronger. But I think women doing upper body is very important. You know, shoulders are great. Keeping your back strong is super important for your posture. So.
I know, and they're little baby weights, but we don't need that much for our adults.
That's right. Yeah, you don't need to be lifting tons of weight. Another key aspect of this is like keeping your shoulder joints healthy, because there's a lot of stability muscles that you can't really see. They're inside your shoulder girdle, and we got to keep those flexible and making sure they're staying strong, and it helps with your posture as well. After your surgery, how much, and we did some of those changes for you, how much easier was it for you to get back in the gym, and you know, you felt more confident in how you looked? Was it easier for you? Did it make things better?
It was definitely easier because, like I said, I felt more confident in my skin, right? And I didn't feel like people were going to judge me. Not that it's right, but you know, when you see a bigger person, sometimes you're just like, oh wow, what are they doing here?
Right,
you know,
right.
And so I felt like I belonged. You know, that people weren't going to judge me, so that helped me to want to come to the gym.
Yeah.
So yeah.
And you did more of it.
Yes.
Yeah.
Yes.
And you enjoy it.
And I do.
And that's the key.
Yes, that's why
the key.
keep trying things till you find something that you love.
Right, right.
So.
That's it. And we talked about that too. So it doesn't really, like obviously bodybuilding is one of my hobbies, but and I like weight training personally. And we can talk about why. And the reason for that is, for me as a surgeon, I cannot get hurt. I'm basically a day laborer, the way I see it. And it's important to keep my back strong. It's important for me to keep my posture strong. I'm standing all day. I work with my hands. I'm just a hand laborer basically. And so I need to keep my body strong, and that way I can do this for another couple decades, hopefully. So weight training is very controlled for me. I don't ego lift anymore. I don't lift anything crazy heavy. I try to keep my joints healthy. I do my massage therapy. I'm very, very, very intentional with my movements, and it's all about quality. But for other people who are in different occupations, I would say the exercising component is super important just for maintenance of health, but we want to maintain muscle mass. And muscle mass is maintained with putting the muscles under tension and resistance. So the fastest way and easy way to do that is like weights. You do bands, that TRX, but you got to keep tension on your muscles to stimulate your muscles to stay strong. And then when you maintain your muscle mass, what's going to happen is that your tendons stay strong. Your tendons are pulling on your bones, so your bones stay strong. And then also maintaining muscle mass maintains higher metabolism, because your muscle is going to be worked out. It has more insulin receptors to bring sugar from the blood into the muscle. And so your insulin sensitivity goes down because you have more insulin receptors on your muscle. So your muscles are going to be asking for glucose versus your fat cells. So when you're sedentary, you don't do anything, your body is taking in calories and doesn't know what to do with it. So your fat cells are like, hey, I'll take the glucose. And so it becomes, that's how you end up with diabetes, and you really mess up your insulin sensitivity because you're not weight training. When you're stimulating your weight training, doing resistance training, your muscles are constantly asking for glucose, and they will still stronger. So that's one of the longevity hacks, is we want to keep you doing resistance training, some kind of exercising. So Pilates is great, tons of resistance in that. Weight training, these HIIT training is great. you know, it's really, you can do pretty much anything at your house.
Yeah.
Like just pull some stuff out in the garage. You got like little baby weights up to 10 pounds. You can get bands. You know, you can just do squats with you know, the kettlebells. There's so many things you could do.
Yeah.
Just body weight wise, that will keep your body strong and healthy for life.
For sure.
So, what do you have at home? Do you have anything at home?
I have a bench. You know, I have some dumbbells. I have a small bar, not anything that robust.
Right.
But I have bands.
Right.
You know, and it was just what I could get my hands on during COVID, because everything got sold out. You know,
changed.
But yeah, so I have that if I need it.
Yeah.
But like I said, I actually really enjoy the group fitness, because you know, we'll do challenges. We're on teams, and so we hold each other accountable.
Yeah.
Because when you're at home, it's just you, and you know.
Yeah.
This show's on. Let me watch TV instead.
Well, it definitely takes, you know, a different mindset when you're working out by yourself at home.
Yes.
So that is something that kind of forced everybody into that mindset during COVID, right?
Yeah.
So it was really cool to watch like Peloton explode.
Yes, that's when I got my Peloton. Actually,
you know, because you're by yourself, but you're in a group fitness situation, right? So that's great. Peloton's awesome.
Yeah.
Now Peloton's incorporates weight training, so they have like your little weights so you can do at the same time, which is awesome.
Yeah.
There's a new body system. It's called, I think it's called Tonal. Is that
Tonal?
you know?
Yeah.
There's a Tonal system, this beautiful machine that looks like a mirror. It's on the wall, and it has these arms, it has these cables, and it controls resistance electronically. That thing is awesome. That's a kind of like a home gym in itself. It takes very, very, very minimal square footage. A lot of women and men are actually enjoying that. One of my best friends has one of those, and he loves it.
Yeah.
But whether you like group fitness stuff or you like working out at home, there's definitely a lot of choices to pick from, right?
Yeah.
I mean, now Tonal has like group fitness stuff that you can do alongside your, you know, virtually with like hundreds of people basically.
Yeah.
And you have these competitions you can do, right? It's pretty cool.
Yes.
You have a Peloton, don't you?
Yes, I have a Peloton.
You still use it?
I do whenever I can't get here, or in the summer when it's just too hot to be outdoors. I will use it more during the summer to get my cardio in. Yeah.
Great. I love it. I love the Peloton. I think it's a good thing for just really the whole body.
Yeah.
Whole body training.
Yeah.
Cool.
Yeah.
Curious, what else do you like to do?
What else do I like to do? Well,
What do y'all do for core?
for core, okay. Well, we can just use this. So we'll do dead bugs sometimes with the kettlebells.
Dead bugs.
Yeah. So
I don't think I know what a dead bug is.
you've seen these. Corey did these during your boot camp.
Women going through menopause and post-menopause, how important it is to kind of keep your body strong. And I think a lot of the body strength for longevity has to do with your core.
Yes.
So that's, you know, that's something that that definitely is, I think most women don't fully appreciate. So core exercise, like just what you just showed us, that's like a great example of it. You know, doing body squats. You could do like Pilates. Pilates is very, very, very core, very core centric. So I'm a huge fan of the Pilates movements.
Or there's lots of different things that we can do. You know, like the little chopping. So I can't do a really heavy weight with that, but
good.
So yeah.
I mean, you can do those. You've done these with weights like this, right? Yeah. Where you take one of these and kind of stand. You kind of do like a squat core thing, you know, like this. Right? Kind of come across. And you can do that with that thing too. That's pretty cool. Where you do like the shoulder press like that.
With the landmine.
Yeah. It's really, there's so many varieties of exercise you can do with very, very, very minimal weight. For core strengthening. So one thing we talked about, Anastasia, is when I brought the weight loss peptide tirzepatide to the practice. Remember we talked about that?
Yes.
And I think we got you on it for a little bit, didn't we?
Yes, I was on it for a little over 4 months, and then I started weaning off of it.
Did you feel like it helped you?
Oh yeah, it most definitely did. Because in August, I got put on blood pressure medicine. I was pre-diabetic, and probably for the last 2 decades, my cholesterol has been borderline high. Within 2 months of being on that, I was no longer pre-diabetic. All my labs were within normal limits,
Yeah.
And last week, I got taken off of my blood pressure medicine. So it was a game changer for me.
Yeah.
So yeah. And then it helped me lose that last, 10, 15 pounds I
Yeah.
couldn't lose on my own.
Yeah. I think that peptide specifically, that tirzepatide, which is like the cousin to semaglutide, which is Ozempic, everybody knows, has changed so many lives in a good way. And that's why I brought it to the practice. I think it's something that can help a lot of people and helps the ball, get started, rolling. But I think we talked about this when we got you started on. It's so important that you're still exercising.
Yes.
Because if you're not exercising, what's going to happen is you're going to lose your muscle mass, and then you have this compounded effect. So all these people that are taking tirzepatide alone and they're not exercising, and they're over 40, especially if you're female, you're already losing 1% of muscle mass per year after the age of 30. And then when you get on this tirzepatide, you decrease your calorie, and your body starts catabolizing itself. And to get calories, what it starts doing, it starts burning your muscle preferentially. And so you will lose muscle mass even more rapidly if you're not exercising when you're on these medications. And now you've done yourself a double disservice. And so now you have this huge uphill battle, for longevity as you're fighting, is that you basically just burned all your muscle you've had already twice as fast. Yeah. And so people who are on this medication, is so important that you're exercising. You've done everything I've told you to do. So you're maintaining muscle mass, and then that fuels your metabolism, so you're burning more efficiently, you're burning more fat efficiently, and then on top of that, you're maintaining your muscle and keeping them strong, and then keeping your bones strong. And then before you know it, you're coming off of medications. You're coming off of blood pressure medications. You're no longer pre-diabetic, and then you start really feeling better, right? And then you're what? How old are you?
51.
51. Can you believe that? She looks amazing.
Thank
so
you.
And you don't look 51.
Thank you.
That's what's incredible, is that when you really kind of start changing some of the aspects in life, that now you have this kind of longevity hack that your body is probably looks like it's 30.
Yeah.
Like, that's what's so important.
Because y'all do the monthly scans there, right? To look at your body composition and stuff like that. And Lauren, the nurse there, she basically said that from what she can remember, I was the first patient to I gained muscle while I was on it. It wasn't a lot of muscle, but I gained a little bit of muscle.
Yeah.
So I was like, yay, you can do it. Because people just assume that you're going to just lose muscle when you're on it, and it doesn't have to be that way. Because I did enjoy going and seeing her monthly, seeing my scans, knowing that I was getting enough protein in, which eat your protein. Get your protein in. And it was just great. I would do it again in a heartbeat if I had to.
Yeah. Well, I'm glad you followed orders. I remember you sending me that text when you showed me that scan, that second follow-up scan, that you gained some muscle. Yeah. And that is so awesome.
Yes.
You're doing it right.
Yes.
Well, good.
It can be done.
All right, we have just wrapped it up, and then Anastasia took you through one of our workouts they like to do. A little bit of everything, a little bit upper body, a little bit of lower body. Talked about compound movements. We had some great conversations about longevity, female health, importance of nutrition. So we covered a lot of ground today. Thank you again for having me. Appreciate it, and thanks for showing the world that it can be done, and then you can look younger than your steady age. So congratulations on your transformation. I'm so proud of you.
Thank you.
And you're still I see you getting stronger every day, it seems like.
I'm trying.
Yeah.
I'm trying.
Well, good job. I hope you enjoyed this FitDoc Recovery Series. Don't forget, like and subscribe, drop us a comment down below, and stay tuned for the next FitDoc Recovery Series.